when an atom loses a particle, most often an electron, and becomes charged. The ability to ionize atoms is important because it can disrupt biological molecules and potentially kill cells. This is the basics of how we use radiation to kill cancer cells. You may be wondering, how on earth do we produce this radiation? Broadly speaking, all radiation must come from a source. Visible light comes from the sun or your flashlight. Radio waves may come from your smartphone. But where do cancer-killing X-rays come from? X-rays for cancer treatment are commonly generated by a linear accelerator. In this machine, high-speed particles, often electrons, collide with a metal target and photons are released. This photon beam can then be directed towards a patient and their tumor. Electrons and protons are alternative radiation types to photons. They deliver ionizing energy with differing patterns that can also treat cancers. They are, however, less commonly used. Mechanism of action. How does radiation damage cancer cells? At the cellular level, radiation can cause direct DNA damage or indirect DNA damage. Most of our current radiation techniques cause indirect DNA damage. This is when radiation contacts water around target cells to cause reactions that produce free radicals. Additional contact with nearby oxygen produces an even more toxic superoxide. These radicals in turn cause damage to the cell. Direct damage is less common. Heavier particles, like protons, rely on this form of damage. The goal of radiotherapy and other cancer treatments is to produce a double-strand break. This is when both strands of polynucleotides are broken at the same spot. This should understandably be harder for cancer cells to repair. Enough accumulation of these double-strand breaks will hopefully lead to cell death. It is easiest to cause a double-strand break when a cell is in its M phase of the cell cycle. This is when the chromosome is dividing. Cancer cells divide more often than normal cells. That is, their cell cycles repeat more frequently. This makes cancer cells more vulnerable to radiation than normal cells. Keep in mind, a tumor will contain thousands of cancer cells. If we gave a one-time, giant dose of radiation, not every cell would be in its M phase, and therefore not equally affected. To distribute damage, we break up the total dose of radiation into smaller amounts given over multiple days. This is called fractionation. This increases the chance of radiation catching a cell in its M phase and causing adequate DNA damage.
Like all cancer treatments, radiotherapy does have some side effects. These affect people differently, so it's hard to predict how your body may respond. Side effects are normally localized to the area of the body that is being treated. These will be discussed with you by your doctor prior to commencing treatment. The good news is that the majority of side effects can be managed and will disappear when treatment stops. There are many misconceptions around radiotherapy. Let's take a look at some. It causes hair loss on the head. Unlike chemotherapy, radiotherapy will not cause hair loss unless treatment is directed to the head. It's painful. When receiving treatment, most people experience nothing more serious than a tingling sensation and slight warming of the skin. After multiple treatments, the skin around the site may feel sore and look red. This is completely normal and will resolve. It makes you radioactive. In fact, external beam radiotherapy doesn't make you radioactive. The radiation passes through your body, so when treatment has finished, you can go home.